Dear friends, my name is Dr. Anurag Saxena. I am Senior Consultant Neurosurgeon and Spine Surgeon, and today we are going to talk with you regarding spinal fusion or fixation surgeries. What is exactly spinal fusion and fixation surgery? So it is a surgical technique which involves fixing two or more of vertebrae of your spine together with help of metallic implants, typically screws and rods, so that in time the bone overgrows the vertebrae and they fuse and become a single block of bone. In most of the cases, but not all, sometimes the disc between the two vertebrae is also removed and the space thus created is replaced by a cage. This cage acts as a buffer between the two bones and helps in the bone growth. Now the next question arises is, in what cases exactly this spine surgery or spinal fixation or fusion surgery is needed? It is typically needed in degenerative spine cases, which means a spine where there is degeneration because of aging or other causes, causing slipping of your vertebrae or problem in the joints of the spine, which are also called as facet joints. And with aging or other problems, the joint becomes stiff or starts to pain, just like arthritis in your knees. And in those cases, the joints have to be immobilized to reduce the pain. Other causes are slipping of the vertebra. So if your vertebrae are slipping over each other, and this abnormal slipping or abnormal motion of the vertebrae is causing you severe back pain, sometimes pain in your legs, which is commonly called as sciatica, or neural compression, which can lead to weakness in both of the legs. In that case, the abnormal motion has to be fixed. Now, the fixation is usually done, as I've already told you, with screws, rods, and putting a cage in, and this is a part of a spinal fusion and fixation surgeries. Other indications are spinal traumas or injuries and fractures where unstable spine is fixed with help of screws and rods. Tumors which are causing spinal instability are also treated in this manner. Now, how exactly it is done? There are two main techniques of doing spinal fusion or fixation surgeries. One is an open technique, which is commonly followed, which means is giving cut in the back with a small cut or sometimes a big cut. The spine is exposed and the vertebrae are exposed and the screws are placed in it. And through microscope, a decompression surgery is done and sometimes the disc is removed and cage is placed. The other technique, which is rapidly gaining popularity, is minimally invasive technique, which involves putting small cuts in your back, not a big cut, without causing any blood loss. Sometimes it is also called as a keyhole surgery. We are able to put screws and we are able to take the disc out and cage with small cuts and tubes. This obviously is a better technique because it involves only giving small cuts or sometimes puncture wounds, and there are hardly any blood loss or complications of this kind of surgeries which are commonly encountered in open surgeries, and that's why the popularity is rapidly increasing. Now the most common question which is asked is this kind of surgery safe? Now, when indicated and done in proper experts' hands, this surgery is very safe and the complication rates are as compared to surgery in any other part of your body. And nowadays, with newer techniques getting incorporated in neurosurgical field, then newer instruments like good microscopes, good x-rays and good quality of implants, the risk complications are very minimal, and this surgery is relatively very safe surgery nowadays. Other questions asked are, would I be able to walk after the spine surgery, or whether my spine will get stiff after the surgery? Well, the answer is it largely depends on the levels which we are going to fuse. So if it is a large fusion, yes, there is some kind of a stiffness which can develop, but with physiotherapy and regular exercises and guided occupational therapy, you can get your mobility back. Most of the surgeries in spine surgeries, if you are already walking before surgeries, then yes, you can walk after the surgery. We do not make you walk immediately after any spine surgery, but in due course of time, within a day or two, you should be able to walk, and within few weeks, you should be up and running to your regular work. Another question is asked is, if the metal implants are put into the body, can an MRI be done? Well, nowadays the implants are completely MRI compatible, and good quality of implants when put together, there is no problem in getting an MRI done in future. I hope this information was helpful. Thank you.